Okay, good morning, good afternoon, good evening po everyone. Saan man panig po kayo ng mundo naroon. Welcome to our 126th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you po for being part of our credible online community, and to all those who have just discovered us for today, welcome po at sana po marami po kayo matutunan sa ating pong topic for today's webinar. The past 2.5 years have been a period of trials and intense learning for everyone. And one of the most important obstacles has been how to keep our workforce afloat, protecting our workers in critical service delivery areas such as in energy, water, food, healthcare, and enforcement. They have been challenging, but there seems to be a silver lining to whatever clouds have come our way. So in today's webinar po, ang sasagutin po nating katanungan, may liwanag ba ang bukas para sa mga health workers? What are the lessons gained from the pandemic? I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. Always looking forward also to sharing hosting duties with our adjunct research faculty at the National Telehealth Center, Dr. Susie Pineda Mercado. Dr. Susie.
Thank you so much, Raymond. May liwanag bang bukas? Grabe, no? Parang pelikula.
Malalim
Syempre,
masyado.
Parang pag may buhay, may pag-asa, di ba? Pinatutuwa lang namin kayo. Welcome, everyone, to the webinar. We are very happy that you're here. We'd like to welcome all those who are in the Zoom, but we understand that we have a growing audience on YouTube and Facebook Live. So welcome po sa inyo lahat. And you can also watch the entire episode on playback on YouTube or at the TVUP Signal TV Channel 101. So yung pong hanapin nyo ha, Channel 101 ay nakikita na po tayo on television. All right. So in this episode, we have a very special guest, Dr. JOSELITO GAPAS, Head of the Occupational Health of First Philippine Holdings and the Lopez Group of Companies. And he will be talking about his experience in workplace preparedness and response to the pandemic. But he will also talk about how the health facility is a workplace and what are we looking forward to as health workers. We have many health workers who are with us in the audience. Now, for our reactor, we've got veteran journalist ROBY ALAMPAY. Not the first time you have him, one of our favorites. And he will be reacting and also sharing his experience as a manager of a startup, PumaPodcast. And for our closing, we have Dr. STELLA Jose, Deputy Director for Health Operations of UP PGH. So in our opening billboard, you can see that we don't just talk about COVID, but today we are talking about COVID again, but we also cover other infections, viruses, and disasters. But we know that you are all keen to find out what the latest developments are here and abroad. And it's for this purpose that we bring you the news update.
Thank you so much, Dr. Susie. I apologize for my voice po kung medyo hoarse siya, pero maraming salamat pa rin po for all of you who are here in our webinar. For our very first news update, Britain po, ang United Kingdom po, yung pong kanilang NICE, or it's the one really that conducts all of the health technology assessments and reviews po nila. And NICE is an acronym, stands for National Institute for Health and Care Excellence. They recommend against the use of the NHS of 5 treatments because these are not cost-effective. So ito pong ahensya ng Britanya, they determine if medicines should be used by the National Health Service, and as a consequence, they have recommended stopping the use of 5 COVID-19 treatments. Kasama na po dito yung antiviral pill ng Merck for high-risk patients because of its, hindi daw po siya cost-effectiveness. The recommendations are still in draft form, and until the final guidance is published, access to these COVID-19 medications will still continue. However, it did not say when the final guidance will be published. Yung NICE po, they recommended against mga COVID treatments, the one by GSK, and partner nila na Vir Biotechnologies na ang gamot po is Sotrovimab, which is an antibody therapy that the World Health Organization recommended against in September. And the other two are combination antibody treatments, Evusheld from AstraZeneca at saka yung Ronapriv ng Roche po. However, sa kabilang banda, the NICE, they recommend 3 treatments for COVID in adults. Yung pong Paxlovid ng Pfizer and po yung dalawang repurpose po nilang arthritis drugs such as Roactemra from Roche and Olumiant by Eli Lilly. Subject to approval pa rin po ng Britannia or UK for treating COVID-19. How about you, Dr. Susie?
Thank you very much, Raymond. So the DOH lists its options for COVID-19 response if public health emergency bill will not be passed by December. So apparently there are 2 very important bills that are priority of the Marcos administration. This is the bill for the Philippine Center for Disease Prevention and Control and the Public Health Emergency Bill. And if these 2 bills pass or are merged, then the DOH will be able to do contingency procurements and do preparations without declaring a state of emergency. So they're hoping that the bill will be passed by December. These bills will be passed by December. But if they are not passed by December, the alternative will be to ask President Marcos to extend the declaration of the state of emergency. And that's our news for today. Next week, we'll be back with more news for you on the news update. Okay, tuloy-tuloy tayo. Oops, di pa natatanggal yung aking news. Sandali ha. Raymond, ikaw muna.
No problem, Dr. Susie. So tuloy-tuloy po tayo, no? Just a little bit of housekeeping. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. Those who say na hindi pa po nila natatanggap, nakapag-release na po kami kasi ng webinars 1 to 1 to 4. Yung 1 to 5 na lang po yung medyo kulang. Pero if you feel you should have received but did not for 125 pababa, please let us know by emailing stopcoviddeaths@up.edu.ph. Dr. Susie?
Okay, thank you so much, Raymond. We're using the format that we had last time, no? Which is, we are now introducing the person on the street asking questions. No, so we will have questions which we took from our audience, and our speakers will answer them after the presentation. Sige, so punta na tayo sa fun quiz, no? We have an intro to introduce it, which makes us all smile. I don't know. So let's go to the intro for the fun quiz.
Hello.
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Natatawa ako, Raymond, kasi napaka-random eh. I know, Raymond, you're straining your voice a little, so let me be the one to read the questions at ikaw na lang bumati sa audience, okay? So, our question for today, our first question, and for those of you who are in Zoom, please, you can use the poll, but you may also use Slido. So join at slido.com 5405717. And let's go to our first question, which I know many of you are waiting for. Gusto nyo talagang malaman kung mawa 100 nyo itong quiz natin eh. Okay, ano ang ibig sabihin ng healthy and safe workplace? 1, may access ang manggagawa sa serbisyong pangkalusugan. 2, pinag-uusapan sa kumpanya ang kalusugan ng mga manggagawa. 3, ang kumpanya ay may mga polisiya tungkol sa pangkalusugang benepisyo ng mga manggagawa. So access, pinag-uusapan, at may polisiya. Okay, and the fourth one is all of the above. Okay, Raymond, batiin mo ang ating mga nakikinig.
Okay, thank you so much, Dr. Susie. Would like to greet those who are joining us all the way from the ACE Medical Center in Bay Point. So Bay Freeport Zone in Olongapo, the Department of Education Regional Office 5 in Legazpi City in Albay, UP Visayas University Library in Miagao, Iloilo, Mactan Doctors Hospital in Lapu-Lapu City in Cebu, and City Health Insurance Office in Cagayan de Oro. There are those joining us from the TTBDO office, UP Mindanao in Davao City, from Marilao, Bulacan, Dr. Joseph Tortona, UPPGH Ward 1 Medicine. Maraming salamat po. Those who are joining us from Technological Institute of the Philippines Medical Services in Manila, our regulars from Bataan, our regulars from DepEd po, no? From the Schools Division of Isabela, Regional Office of Tuguegarao, Region 2. Thank you so much. Those who are joining us all the way from Los Baños, from RPHS Annex 1 in Antipolo, Dr. Menzi Ramos, from Cavite, as well from Ozamis City, those who are joining us all the way from NTC, and from University of Rizal System Health Services Unit in Morong, Rizal. Question number 2, Dr. Susie.
Okay, question number 2. The following are, English naman. Okay, the following are examples of opportunities for the healthcare workers. First, health workers are one of the most important resource in the country. 2, health workers were given a voice in the policy and decision-making table of organizations. 3, healthcare workers have become competent in communicating health and using IT technology or IT. And the last one is health workers realized the importance of life-work balance, or all of the above. So,
Correct.
sige, sagot na kayo. Okay, Raymond. Teka,
Yes.
Raymond, bago mo batiin yung mga, may suggestion ako. Ang suggestion daw kasi pag parang meron kang palakas sa lalamunan, ay kumanta ka daw.
Manta. Ano?
Sige, go ahead, Raymond. Go ahead.
Internationally, we're also being viewed po, no, from the Chonin Hospital in Taipei City, Taiwan, Nguyen Thai Hoc Polyclinic in Vietnam, University Fail, Saudi Arabia, Dubai, United Arab Emirates, Lunichi Ali University of Blida 2 in Algeria, and our regulars from Los Angeles, California. So hindi po muna namin isasara itong fun quiz po natin as we move on to our webinar proper, Dr. Susie.
Okay, thanks so much, Raymond. Okay, so let's, without further ado, let's go to our main speaker for today. I announced who he is already, and the last time he was on the webinar, apart from, I don't know how many hundreds were on the Zoom, we had an additional 700 in the YouTube playback, no?
Correct.
So we're happy to have him back. He talked last time about work bubbles.
He was here last week, Dr. Susie.
Huh?
He was here last week asking the question.
Yeah. The question last week, oo. Oo nga pala. So ngayon, meron siyang gustong i-share sa atin na pananaw. And sabi ko nga kanina, medyo madrama yung ating title, no? May liwanag ba ang bukas? Pero it's a good question. 'Di ba? Kasi parang kung endemic ito, what does it mean for all of us? And I think we're all looking forward to the presentation of Dr. Lito GAPAS. We'd like to welcome him. He's the head of Occupational Health at First Philippine Holdings. Lito, welcome to the webinar.
Thank you very much, Susie and Raymond. Thank you very much for the very warm welcome. It is always a pleasure to be here in Stop COVID. And I am a regular viewer, and I always look forward to every Friday on the topics that is discussed. Magandang umaga po sa inyo lahat.
Sige, go ahead, Lito.
Okay. First of all, I'd like to share my presentation. Okay. Right. See. Okay, so good morning, good afternoon, good evening to everybody sa mga lahat ng participants dito sa ating webinar. Ang title ng ating presentation today is May liwanag ba ang bukas para sa mga health workers? Lessons learned or lessons gained from the pandemic. And I'm Dr. Lito GAPAS. I'm an adjunct professor of the Department of Environmental and Occupational Health, the College of Public Health. My full-time job is also I'm the Occupational and Environmental Health Executive of First Philippine Holdings Corporation. And uh, First Philippine Holdings prides itself with our business compass, which is to forging pathways for a decarbonized and regenerative future. We try to become a very green company because later on sa ating pinapag-uusapan, makikita nyo kung paano magsasama-sama ang interest ng human health, animal health, and the health of the environment. Okay, so moving forward, okay, I'd like to start with a quote from Sir Winston Churchill. Ang sinabi niya is that never let a good crisis go to waste. Okay. For the past 3 years that we're undergoing the COVID outbreak, we had a crisis. And we should never let a good crisis go to waste. By not looking back, titingnan natin kung ano yung ating natutunan at nadiskubre at napag-aralan so that when future outbreaks come along, we are in a better position. This statement was made by Sir Winston Churchill, the British Prime Minister during World War II. With this statement, Churchill was able to convince an entire nation to fight against Nazi occupation, knowing that to do so would mean sacrifice, loss, and a new miserable normal for Britain's people. This statement caused us to look for a silver lining during crisis and seek opportunities where they might not have been. Okay. So, as we move on, it is inevitable na palagi nating pag-uusapan yung COVID-19 outbreak. So let us look back. Ano ba ang kwento ng Pilipinas tungkol sa COVID-19 outbreak? So this started around the first part of 2020. So initially we had the Wuhan virus that came. Then as we moved forward, we had the first surge coming from the original virus. Around February of 2021, nag-umpisa yung surge naman natin, the second surge for Alpha. Then sometime in September of 2021, napakasakit at napakahirap na Delta surge. Pinagdaanan natin lahat yan. And recently, last January, we have observed a very swift and high COVID surge now driven by Omicron, BA.1 and BA.2. As we go to the tail end of the outbreak and moving to the present, if you focus on the right figure, makikita natin, I borrowed this from one of my favorite experts in the Philippines, Father Nicanor Austriaco of Octa. And when he made his presentation, sinasabi niya na, okay, we've had our recent curve driven by the Omicron BA.4 and BA.5. Pero after that, around October, nagplateau. And what is this? There is a possibility that this was now being driven by the new COVID outbreak, XBB and XBC. This might be the surge which is overlapping with the surge driven by BA.4 and BA.5. But only our genome centers will determine if this is indeed true. But nevertheless, the COVID cases reported to the Department of Health continue to decline to the present. We know that these are underestimate of the real number of cases there because of reporting and testing limitations. However, the trend is very clear. Pababa ang number of cases of COVID in the country. So to wrap this slide, the ongoing COVID outbreak has been very difficult and challenging period for the country, the economy, our people, and healthcare workers. It is likely that we are headed towards a good Christmas and hopefully a better 2023 with more vaccination and no serious COVID variant in the horizon. At present, we can say that the risk to the health of workers, including healthcare workers, are lower than ever. Sa lahat ng pinagdaanan natin for the past 3 years, ito yung panahon na yung risk, apparently, I think, my personal perspective, is mababa. Bakit siya mababa? Bago natin pag-usapan yun, let's talk about risk. Palagi kasi nating naririnig yung word na risk sa ating discussion sa media, sa ating mga uh, presentations. Pero ano ba talaga ang risk? Risk is composed of two things: the probability and the consequence. Pag titingnan natin ito from the lens of the COVID outbreak, then probability can be translated as ano ba yung chance of getting infected with COVID? Consequence is ano ba yung severity of the outcome? Okay? Now, with this, let us dig deeper. Pag pinagsasama natin ang concept ng probability and consequence, ito yung tinatawag nating risk. Mataas ang risk pag mataas ang probability at mataas ang consequence. But let's dissect this further. Ano ba talaga sa ngayon ang probability of getting infected with COVID? There are many things that we have already implemented and will continue to implement. Number one is vaccination. We all know na pag nabakunahan ka, lumiliit ang probability mo na magka-COVID. Number two, we have established minimum public health standards from masking, distancing, and personal hygiene. It decreases the probability of infection as well. When we go back to work, we even implement return to work screening. We have testing modalities right now, such as antigen testing, or such as RT-PCR testing. Nasa maaga pa lang, we determine people who are infected and bring them out of the workplace, lowering the probability of spreading the infection. We have mastered the art of isolation and quarantine. Right now, ang pinag-uusapan natin, ventilation in indoor workspaces. Again, to decrease the probability of infection at work. We have hybrid work, and some companies, including ours, ang tingin nga namin ngayon, we are more virtual, but not always. At very important, because of better and improved education and awareness of all stakeholders, we are better and in a better position to implement all these control measures, leading to a lower probability or a lower chance of being infected with COVID. Then let us look at the consequence. Consequence naman is what happens when a person becomes infected with COVID. How severe is the outcome? And we have controls for that through the past 3 years. Marami tayong natutunan at marami tayong in-implement. Again, vaccination is the key because we know that vaccination provides long-term protection against severe disease na nagdadala sa atin sa mga hospital, ICU, or even causes death. So, vaccination, you could see, decreases the probability and decreases the consequence of COVID-19. We now have early diagnosis and treatment modalities, molnupiravir, Paxlovid, the antivirals, and immunotherapy. Marami nang lumabas ngayon. We are now focusing on high-risk groups to reduce the consequence of infection to them. Our medical facilities, low capacity as they are before COVID, have improved for the better. And lastly, with God's blessing and grace, the Omicron subvariant at present has lower disease severity. So lahat ng ito, if we put together, masasabi natin na at present, the risk of COVID to workers, including healthcare workers, are lower than ever. We communicate and collaborate better than before. We are better organized. We can mobilize more resources. And we know more about COVID-19. So keep in mind that the risk to COVID at this time is lower than ever. However, we should not be complacent. We should always be on guard Kasi epidemics are never-ending cycle. At this time, or for the past 2.5 years, we have experienced an epidemic of COVID-19. They arrived in this world with native population completely unprotected. It is this situation nagkakaroon tayo ng outbreak. And as we move forward through time, because of vaccination, because of infection that we have recovered, population and our country and our people have developed herd immunity already. And as we develop herd immunity, we begin to see that the number of COVID cases could begin to decline. Nakikita na natin ngayon yan. And eventually, the epidemic will disappear and we transition to an endemic scenario. We stay that way. We hope it would be longer. But again, anong nangyayari? Population gradually lose their immunity. And when this happens, if we fail to be regularly vaccinated, for example, at a certain lowest point, an outbreak or an infectious disease like COVID will reemerge with a new variant or a new subvariant that is more infectious or more severe, and we go through the same cycle again. Ito po ang nature ng outbreaks. It's a never-ending cycle. Pag tinitingnan natin yan, longer term. So ano ang driving factors kung bakit maaaring mangyari ito sa COVID? One is immune escape. Alam natin yon. Variants come in that are better able to escape existing immunity. Waning immunity. Alam natin ang ating mga bakuna, nagwi-wane ang kanilang epekto. Ang nakakalungkot lang is nagwi-wane din ang interest ng ating mga kababayan na magkaroon ng booster dose. There is uneven vaccine distribution. Okay? Some areas have more access, some less access. Malaking problema ito. Like for example, sa India or South Africa. At the start of the outbreak or even in the middle, they have less access to vaccine. Doon nang galing ang mga subvariants because people become incubator for new variants. We have vaccine hesitancy. We have lack of political will and integrated and coordinated global effort. We even have not discovered yet. Ano ba ang animal reservoir ng COVID virus? Nasaan ba ito? Because if we cannot address that, then we expect that COVID might assume a never-ending cycle moving to the future. So what does the future hold? The threat of infection and infectious disease outbreaks is getting bigger. The interval between potential outbreaks are getting shorter. We have emerging diseases, what we call the novel virus. We have SARS-CoV-1, SARS-CoV-2, the COVID outbreak, H1N1 and others. Let us not forget that we have re-emerging endemic diseases as well. Dengue, Zika, Ebola, monkeypox, West Nile fever, polio. Lahat yan, we are living with this endemic disease, which has the potential to emerge and become an outbreak. So according to the WHO, the risk of epidemics is increasing because of increasing global population, increasing mobility of people, animals, and plants. We move faster, we move all over the world now. And there is increasing urban density. Karamihan ng ating tao umaalis from rural areas at pumupunta sa urban areas. It increases the potential for infection and outbreak. Because of the increase of all of this, there is now increasing pressure on natural systems like deforestation, human encroachment into the natural world, and changing ecosystems of species. And now we have climate change to make epidemics worse. Okay. So for the future, Susie, I'd like to switch microphone. I think my microphone is
Go
running
ahead.
out of
Go ahead.
battery. Okay, sige.
Sige,
Thank
sige.
you.
You need a break? Okay. So antayin mo. Let's just wait. Oh, sorry. Okay, so we'll wait a little bit.
How is it now? Is it okay, Susie?
Yeah, it's good. It's great. Go ahead, Lito.
Okay, so apologies. Thank you. So, what are we looking forward now for the future? Kailangan meron tayong diskarte. Globally, regionally, nationally, and even our local organizations. Ito yung mga tanong, paano ba tayo maghahanda for future outbreaks? The good thing is, with many global agencies like the World Health Organization, ang tinutumbok na nila for the future is what we call the One Health approach in addressing future outbreaks. A One Health approach shall protect human, animal health, and their shared environment via a global and integrated strategy. So it begins to link issues like vaccination between humans and animals. Bakit natin hihintayin na tumalon ang outbreak, ang isang infectious disease or virus sa mga tao kung malalaman natin yung animal reservoir nito at mabakunahan yung mga animals that are risk. So we have to be more integrated in our approach and more proactive. Animal and human monitoring is also important to identify potential epidemic or re-emerging infectious diseases. Yung tinatawag natin na epidemiology, siguro meron ding epidemiology not only in people but also in animals. Tinitingnan yung determinants of the distribution of illness amongst animals. Ito yung ating warning, and we have to approach this in an integrated manner. Lastly, very important, the prevention and management of health risk is now dependent on protecting and preserving the environment. So makikita nyo sa figure sa baba, sama-sama sa One Health, yung focus on human health, animal health, and environmental health. But One Health is founded on 3 pillars na napaka-importante at we have learned about its value during the outbreak. Very simple and listed in 3 words. Communication. We should communicate more at our levels, even in our workplaces, even in our hospital settings. To put in our control measures, we should have good communication. Second, we should be better coordinated. Even when we talk about it, when we do something about it, we should be coordinated and we should collaborate. We should build what we call the community responsibility. Na hindi lang ako, hindi lang yung mga pamilya ko ang dapat safe from an outbreak, pati na rin yung mga ibang kasama ko sa pang-araw. We have to see that perspective. We need to communicate, to coordinate, and then collaborate within the framework of One Health. Okay. Now, so moving forward. So what have we learned? I've told you, pinag-usapan natin yung kwento ng outbreak hanggang sa ngayon. Pinag-usapan din natin kung ano ang maaring mangyari at ano yung pwedeng paghandaan sa hinaharap. But let us now move to the second part of this discussion. What have we learned from COVID-19? Is there a silver lining for healthcare workers and workers in general, as well as the community, amidst the ongoing and future outbreaks? Babalik ako sa barkada kong si Sir Winston Churchill. Yung una niyang sinabi, may kasunod yun eh. Ang sabi niya, difficulties mastered are opportunities won. So let us find if there is a silver lining for ourselves, looking back over the past 3 years of COVID outbreak. The COVID outbreak is still ongoing and the crisis remains. And actually, we do not know when the crisis will end. If we have the motivation and we have the capacity to look for the silver lining, by all means, let's do so. So, what has been the impact of the COVID outbreak for healthcare workers? Siruin tayo sa atin. And a healthcare worker can be a frontliner, can be a health program manager, could be a health decision maker, could be teams working in the public sector, in the private sector. It cuts through all the sectors of healthcare workers. So very broad ang naging impact ng COVID sa mga healthcare workers. We all know this. Healthcare workers got sick. We got stressed. Many of us, especially our frontliners, became stigmatized and overloaded with work. We also know this, that especially for our very gallant frontliners, workplaces and hospital settings in the early part of COVID were very poor, and we have had, and you have had, unsafe working conditions. For example, there's lack of PPE. In the Viber group of my class, it's heartbreaking to hear about suggestion on how to conserve face mask and make it last over 1 week. Parang nakakalungkot na ito yung mga frontliners, but you could see that the protection provided is very, very limited. Our infrastructures, not very good, especially in the private sector bago mag-COVID outbreak, began to deteriorate with the demands of more healthcare with COVID. Our colleagues got sick. We were always concerned when we will be next. Okay. Our wages, even before COVID, especially for those who are working in hospital settings, to be honest, are not really competitive. There were many promises to add more to the pile, to the basket of wages during the outbreak. However, the promised incentives have been delayed, and for some of us in other parts of the country have not been delivered. Looking back and looking at the statistics, there is increase in resignations to work abroad or in other jobs outside of health. Ayaw na nilang mag-nurse, ayaw na nilang mag-practice sa hospital setting. Many of our healthcare workers simply left work to regenerate. Pause muna. I don't know what to do yet, but pause. Because what they know at that time is their workplace is not ideal to their well-being. So I have looked at a few statistics, and I'd like to share some of this with you. By October of 2021, 5 to 10% of nurses in private hospitals resigned. In a single hospital, according to its medical director, his nursing staff went from 200 to 63 in 2021. Overall, 40% of nurses in private hospitals resigned in the course of the outbreak. These are very, very sad statistics. And I think our government and the private sector in the Philippines should seriously look at these driving forces that drive out our workers outside and away from the hospital workplaces. But yet here we are as health workers. We're having this webinar. What does it mean that through all these challenges for the past 3 years, we have survived through it all? We are here, for most of us, if not all, apparently well and thriving. We have been resilient. Akala natin hindi natin kaya. Pero looking back, parang isang masamang panaginip lang yung nakaraang 3 taon. Indeed, we have to realize our first learning personally, we have gone through the past 3 years of the COVID outbreak. We are here, and whatever it is we have internally has managed to bring us to this point. we have been resilient. We have what it takes to survive. Okay, again, looking back, what are the positive things that came out of the COVID-19 outbreak? Hindi lang naman puro sad news. Marami tayong natutunan at maraming nagbago if we can only be made more aware of it. Health workers assumed key roles in infection prevention and control, patient advocacy, and policy making. Nagawa ba natin ito? Oo, marami sa atin gumawa niyan, even going out of their comfort zones and assuming broader roles and and more challenging responsibilities. Healthcare delivery, or a portion of it, shifted to technology-mediated healthcare. Online, like telemedicine, telepharmacy, teleconsultation. Many health professionals adjusted and became competent on IT technology and communication skills. Ito hindi tinuro sa medical school, sa nursing schools, or any other schools ng mga healthcare professionals natin. Pero natutunan natin yan within the span of 3 years. And that is impressive. These are opportunities that we can take advantage of. Our public and media profile of our health professionals have increased. You now could see, not only in the news, but in public webinars, private webinars, lots of health workers, lots of health experts coming in, lending their voice to public information and public debate. We have become more popular. People listen to us more, but still not yet enough. But we continue to speak because we now have a public and media profile. There is also increase in enrollment, by the way, in many health courses as local and international demand accelerated. So this is something that positive that came out of the workplace, of COVID-19 outbreak. On the light side, many health workers, especially when we are making a dent on COVID outbreak, are now being seen. Before we were ostracized. Many health workers and frontliners were ostracized. But you see that there's a gradual shift. And the general attitude now is that frontline health workers were seen as angels and heroes, parang quasi-superhuman, that they're there in the front lines, regardless of the risk, providing healthcare to the needy. Sana lang nga, the public, even if they see many health workers as angels and heroes, wag nilang ma-overlook that all of us that brought us to where we are right now have high level of knowledge and skills of health professionals. Pinag-aralan natin ito, in-enrich ito ng ating experience, and that is what made us individually and collectively better. Hindi lang tayo angels and heroes. So, moving forward, looking back on the past 3 years, what are the lessons learned from the private sector? Ano mga realization ng mga businesses? Number 1, occupational health is as important as any other business activity. And that is a fact. Before, when we talk about health in the workplace, nandun ka sa periphery. Kasi hindi ka ang core activity, hindi ka ang core business. But with the advent of COVID, especially for the past 3 years, suddenly, na-spotlight ang occupational health. And they realized its value. Kaya ang tingin nila ngayon, isa ito sa mga important component ng business activity of an organization. They have also realized the importance of the health of workers and their household members. Many companies or private businesses always pay lip service that their employees are one of the most important assets in the company, and the health of workers is important. Maraming nagsasabi niyan pero lip service. Ngayon, with the experience for the past 3 years in COVID, they have realized that they will need to focus and ensure the health of their workers and their household members para mapagpatuloy nila ang kanilang mga business process and businesses. Pag walang healthy workers, manganganib ang negosyo. And why do we need to focus also on household members? Natutunan din yan sa COVID. Hindi lang naman workers nang tinitingnan, pero yung pamilya niya at kasama niya sa bahay. Because if we don't help the household members, then they are more vulnerable to COVID infection. And since at home they live in one bubble, workers will become infected as well, and they bring COVID to the workplace. Therefore, we now have a more strategic approach to health with focus on workers and their household members, now and in future outbreaks. They've realized that health workers are one of the most important assets of the company. There are many opportunities in our group, in the Lopez Group, that we have stepped forward and stepped up to make sure that we deliver and ensure the safety and health of workers in our businesses. Therefore, our business leaders have realized importante ang health workers. Lalong-lalo na if your business or organization are hospitals and clinics. You are the core of that business. Anong direksyon na ginagawa ng maraming kumpanya ngayon? What they're doing is looking at how do we improve the employee value proposition for health workers. Translated to Filipino, paano natin mapapaigi ang ating kontrata, ang work environment ng mga health workers sa ating kumpanya para hindi sila umalis. And an employee value proposition, tinitingnan maraming aspeto. Pay is very critical. We should have decent and pay so that we can take care of ourselves and our families and our needs. Our work environment is important. We should have a healthy and safe work environment. We should have health services accessible not only to health workers, but to our workers in general. We should provide opportunities for healthcare workers to improve their competency and their training, and also to look at potential career development plans of health workers in our organization. So we have to package this into one bundle under employee value proposition. Otherwise, health workers will vote with their feet and go elsewhere. Not all health workers want to go abroad. Many of us, given the right employee value proposition, would rather remain in the Philippines with our families and friends, where we feel we are first-class citizens. Employee value proposition. Businesses have also realized money spent on health are investments and not expenses. Dati gumagastos ang maraming organization on health para lang mag-comply sa requirements ng Department of Labor and Employment, ng DOLE. Check may clinic, check may doctor, check may nurse, check may mga gamot. Comply. Pero hindi na ngayon. Because we have proven our worth, the attitude has changed. Health expense is now seen as investments by tubo. At anong tubo nito? A healthy and safe workplace and better and safer business environments. In the past, during COVID, now, and looking forward to the future. Very important. Health was given a seat and a voice at the leadership and decision-making table. Maraming mga kumpanya na ngayon are including members of the health team in their strategic meeting. Pinakikinggan because na-realize nila na the health input, especially during COVID and future pandemics, will be one of their guiding lights in defining their business strategy. Before, speaking personally, I do not attend leadership meetings, but now I sit in CEO meetings of our various companies. Palagi niyang tinatanong sa akin, Doc Lito, where are we right now with the COVID outbreak? Where are we going or headed up to the end of the year? What is for us in 2023? Pwede bang tingnan mo yung iyong crystal ball and give us a fearless forecast? Because they take it now as input on their business. And these people are well-read and very much aware of what is ongoing. So I was being very careful as well because I should know what I talk to and tell them when it becomes only a forecast and when it is more reliable. But the important thing is, pinakikinggan ka na. At yung sinasabi mo is important to the leadership for their business strategies. Lessons learned going back to the COVID outbreak or looking back for the past 3 years. What are the opportunities for the health sector? Sa atin, it might not apply to all of us individually, but if you can look at where you are right now, what you're doing, the level that you're working on across the health organization and systems, some of these things might apply. Lessons learned, and this was painfully learned. The COVID-19 crisis is a health crisis. It is not only a medical crisis, it is a public and occupational health crisis. And it is in search of a strategic solution at present and for the long term. Maghahanap sila niyan. May role tayo dyan. Second, as I've mentioned earlier, the outbreak has given health professionals a greater voice and a seat in the decision-making table at all levels of the organization. Whether the organization is public health, private sector, if that organization is involved in clinical health, if these people are in health management, health strategy, and health planning, sinasama na tayo dyan because we have a greater voice. Learning for the private sector. For the past 3 years, it has been a health manpower crisis for many organizations and countries, in fact, globally. The demand for competent health personnel at all levels will be fierce, both locally and abroad. That is a fact. Take advantage of it. The COVID-19 outbreak highlighted the inadequacies of many organizations and health systems. Whether you're at the WHO or the CDC or global, parang bigla silang naliwanagan. Ang dami pa nilang kulang. Public health has been neglected for so many decades. It is one of the lowest specialty in the totem pole of health specialties. And then they've realized COVID came. 3 years of pain and challenges. They have realized that it is a public health crisis. There is urgency to address these inadequacies. Alam nila yan, kailangan nilang ma-address now and in the future. Take advantage of that. The ending is uncertain for the outbreak, but the focus of organization on health and health risk management will persist into the future. Do not forget, these are opportunities that we have learned for the past 3 years. So let us zoom up globally. What are the global realization of the COVID-19 outbreaks? The Filipino as a health professional is a global entity. We are spread all over the world. The Philippines is one of the highest exporters of healthcare talent abroad. So it is important, ano yung pananaw global? Healthcare workers now are seen as every country's most valued resource. Kung ang tingin ng mga kumpanya is ganito, globally ganyan din yung tingin. Globally and even at the country level. There will be investments into the future to bring in competent health workers in all areas of health. There is a need for better and sustainable health organization systems. Nakita natin yan. At the height of COVID, isa sa tinuro sa atin is pilay ang ating global organization, even our national organizations. We were scrambling na bigyan ng mga quick fixes and patches so that health organizations will function. We know, and globally they know, that health professionals had and will continue to assume leadership position at all levels. Therefore, us, as health professionals, we will be called upon to play multiple roles other than our clinical roles. We need to address these roles, we need to become efficient communicators, educators. We need to obtain skills so that we shall be effective in engaging our stakeholders. Many of these skills are not taught in our schools before. We need to be health risk assessor. We need to be able to assess what are the health risks of communities, what are the health risks and health needs of organizations and communities. We will be tasked to develop and implement health strategies, programs, and activities. We will be asked to manage and lead health teams or participate effectively as part of the health team. We will be asked to run health services and care for all the stakeholders, including patients. So kung makikita nyo, marami tayong learnings which could be seen as opportunity for us to take advantage of. But we also need to retool and retrain ourselves. So I'd like to end with a final quote. Dramatic changes inevitably uncovers fresh insights and points to opportunities for growth. Dramatic changes have been observed for the past 3 years during the COVID outbreak. But it also gave us a lot of fresh insights on who we are, what are our capabilities, how do we need to improve ourselves, and what are the opportunities ahead of us. The challenge is for us is, where do we go from here? It is completely okay if you are happy with where you are. But for some of us, they might want to go higher or somewhere better. The window of opportunity for health personnel are now open. What opportunities are open to you at present? Look around, analyze and evaluate. And finally, do you want to take action when an opportunity arises? What is the future that you want? Thank you very much.
Okay.
Dr. Susie, you're on mute.
Okay, thank you so much, Lito. I'm taking a moment because I said this is a professorial lecture, Lito. And I wouldn't say that we have to have, another audience for it because it's now recorded and people can go to it. But it's such an amazing synthesis of lessons. And ito talaga yung public health, yung public health perspective. I think you captured it really very well and in a positive way. And I was just taking a moment to appreciate it. I think we're gonna have a good discussion because you post a question in a very interesting way, what's the future that we want, meaning we actually we have more power, let me put it that way, have more power than we ever had in health. And health has always been political, and we've always been, what should I say, not given the priority in terms of investment, in terms of opportunities, and all of that. So, ganda. Thanks, Lito. Professorial lecture to. By the way, Lito is adjunct faculty of the College of Public Health. So he's a professor of occupational health. And yeah, this is just amazing. Okay, Raymond, over to you.
Thank you, Dr. Susie, and thank you for enlightening us, Dr. Gapas. Maraming salamat po. Please stay on for the questions po that will be posed by our audience. In the meantime, we'd like to remind everyone that for today's Q&A session, please feel free to put in your questions. We will choose po yung mga upvoted questions po ninyo. And we encourage everyone to start typing in your questions in the Zoom Q&A or in the comment section po ng Facebook and YouTube. Okay? It's my pleasure to introduce to you our reactor, very familiar figure to everyone, and also one of your favorites po, no? Very respected veteran journalist and also anchor of a daily news program. He is also the chair and founder of the PumaPodcast startup. Please welcome to your screens, ROBY ALAMPAY.
Hello, magandang araw po sa kanila lahat. Maraming salamat, Raymond. And maraming salamat, Doc Lito. Susie, if you're going to, and I fully agree, but if you're going to call yung presentation ni Doc Lito as a professorial lecture, ako yung estudyante na walang kamuwang-muwang, and I was concerned na parang pumasok ako sa maling kwarto. And in fact, I feel some of my classmates now looking around and saying, ba't pumasok to? Hindi naman to public health worker, hindi naman to health worker, naliligaw yata itong tao to. And to be perfectly honest with everyone, I told Susie when I got this invitation na anong silbi ko dyan? Usually I get invited here to be moderator and I'm happy to facilitate, to ask questions. But I was asked to be reactor. And sabi ko, kung ang topic is workplace environment for health workers, then I don't really know why I would be relevant to this conversation. But thankfully, Doc Lito and as Susie reassured, said, no, we want your reaction on the workplace in general. Because hindi lang, I'm not just a journalist, I also happen to have a startup, a small media startup pa rin. It's called PumaPodcast. We do podcasts. And what might I take away from a conversation about the workplace environment in general? Buti na lang din sinabi ni Doc Lito na, the environment for healthcare workers and non-healthcare workers. So sabi ko, sige, sasabak ako doon. But I do have to say that as the conversation wore on, it became more and more relevant to me, yung insights and inputs ni Doc Lito. Because you could take away the term health care and we could completely relate. And I, as a now, never mind calling it a startup, but as an employer now, which I had never been, I have rarely been in my entire life. I now have about 20 plus people working for me, working for us. We find ourselves in this position of responsibility. It is a position also that can be quite awkward, given that we never really consciously equipped ourselves with many of the questions that we did not anticipate. But let me take you to my personal and our organizational experience through COVID. I think fast forward to the entire experience and everybody can relate to this na totoo pala, no? Para we all agree that a lot of things about our workplace and our work habits and even our work policies before the pandemic, a lot of those things now really don't make sense. I keep thinking, oh nga no, bakit nga ba lahat ng meeting ko kailangan nasa restaurant? Bakit nga ba kailangan ng meeting magmamaneho ka through traffic and paparada ka, magbabayad ka, and then you'll find a place, magsasabihan kayo, sige, kita tayo dito sa cafe na to, kita tayo sa restaurant na to. A lot of it really doesn't make sense. And that was before you even factored in the question of health. No, it was just a matter of logistics. It was just a matter of gastos. It was just a matter of time wasted in traffic, energy that I would rather spend somewhere else. So what we're doing now, for example, on the one hand, parang, oh nga, no, pwede pala mag-conference online. But speaking of conferences online, one of the things that we also realized emerging from the pandemic is that hindi, iba pa rin ang face-to-face. Iba pa rin yung pwede tayo magkita-kita. I can only imagine the energy and the atmosphere if we were all in one room, whether it's at the UP Manila or the UP College of Mass Communications in Diliman, diba? Iba pa rin. In the past months, I've gotten to travel. I've flown to Europe. I just came back from Chiang Mai. After Chiang Mai, I flew to Kathmandu. And for all the awkwardness of riding in a plane, that, to be honest, you sort of suddenly get past quite quickly. You let your guard down really, really quickly. For all of that, once I get to the conference, and these are revenge conferences in my own impression, iba talaga yung face-to-face. Iba pa rin yung nakikipag-usap ka sa mga tao. And so there's that balance that you're trying to seek. And I think for our workplace, that's something that we're trying to strike a balance for. You know, what doesn't make sense and what makes sense. But what was crucial, I think, in this presentation was then throwing in the element of health and how do we look at it? How do we see it? And yun yung dilemma ko, no? Because my startup is also a media startup. And I don't think it's an age, I don't think it's my demographic, and I don't think it's an old-timer's way of thinking. I do think it is a function of media and of journalism. That journalism needs to be face-to-face. In fact, I think what reassured me with this topic today is that I convince myself, I tell myself that, you know, journalists were, and still will be frontliners as well. We knew the role that we needed to play during the pandemic. And during the pandemic, we knew that if our journalists and our reporters were not out there, standing side by side, ideally with healthcare workers, not only will you remain invisible, and not only will the pandemic remain misunderstood and misappreciated, a lot of people will not have the information. We, in a way, if communication is a weakness or a gap among healthcare workers and the healthcare sector, we always knew and we always took pride in the fact that we will try to fill in that gap. And I think that's what brings us together. All of those is just to put into context how I see where I think I can react constructively here. So as a media person, I'm open about this with my staff. Na, okay, we were covering via Zoom all this time. We were recording remotely by this time. But the world is opening up. Filipinos are taking their commutes. People are in traffic. People in highly urbanized centers, in crowded environments, are taking risks that most of us are not. And everything from prices to inflation, to healthcare, to, you know, may trabaho pa ba ako, or how do we keep our job? How do we keep our businesses alive if not growing. All of that is still compounded by this crisis that continues. And for a media company, for an employer, my question is, how far am I allowed to push? How far am I allowed to say that, no, but this is what we do, no? And we cannot keep covering online. We have to be where the people are, not only because that is our job, but also, frankly, in a competitive environment, it is a competitive advantage to demonstrate your direct access to the sources of news, whether it's offices or officials or people and communities. Being right there is a competitive advantage. But then I wear my employer's hat, and I completely understand the hesitation, both implicit and explicit, both expressed and unexpressed by our young staff. And if I swing the other way, I completely understand myself, of course, that, dagdag gastos to. And not just dagdag gastos, hanggang saan ba yung responsibility ko? Especially if all we have guiding us is national policy. If government says, hindi na kailangan mag-mask outdoors, okay, great. That goes out, everybody understands. And then if they say, hindi na rin kailangan mag-mask indoors, okay. And then, basta bakunado, and so on. Recently, as I mentioned, we went to Chiang Mai, Thailand. I brought 5 of our staff were there. We conducted trainings on podcasting for journalism, among other Asian media startups. And nung pauwi na kami, 1 staff of ours tested positive for COVID. Mild symptoms. So it was a no-brainer for us to say, sige, maiiwan ka. Mukhang ma-manage mo naman, binilin namin siya. But 3 days later, nakauwi na kami. The inevitable question, sir, pwede na ba akong umuwi? And you fall back on, well, sige, research natin, ano ba sinabi, gano'ng katagal ba, o 5 days ka na raw nagka-symptoms and so on. And then finally, I just called some people in the airline industry and they said, wala na screening eh. Yeah. And the advice that I got from the private sector, not from government, was basically, sa totoo lang, it's a conscience call. Kasi you can actually now assume that X% of yung makakasama mo sa eroplano are themselves already positive. And once you get the Philippines or wherever your layover is, wala namang magsiscreen sa inyo. And it suddenly dawned on me that even all the knowledge that we had was useless because we didn't know how to guide and we didn't have any policy. Let me jump forward then to what Doc Lito said. He said communication, coordination, collaboration therefore becomes very, very important. And I think that's a given. But our dilemma pa rin is, but what do I communicate? And what exactly am I coordinating and with whom? Kung bumitaw na when government says, well, this is the policy, hindi na kailangan, One Health Pass doesn't require an RT-PCR anymore. You can theoretically fly without even a vaccine, without even getting vaccinated, depending on which country you're going. And then coming home, you just take an RT-PCR, no vaccination records, and you still can come back. So again, we don't know. And then finally, collaboration. And one thing that I am grateful for this webinar is that I'm thinking, we need to collaborate now proactively with healthcare workers and healthcare experts. Because one thing that Dr. Lito said, or 2 things that he said, really brought home the point for me. One is that, for a long time, especially for a journalist and somebody now handling a news media company, for us as a journalist, we've always felt that health and the risks on the other side of health was always a matter of commitment. It was a matter of courage. It was a matter of maybe knowledge. Maybe it's a matter of experience. But it's something that comes with a job. But we never, therefore, looked at it as a matter of right. And we never looked at it as a matter of responsibility. And I think Dr. Lito brought home that point. But after we recognize it, not only as a matter of right on the part of our employees, but as a matter of responsibility on our part, the investors and the entrepreneurs, then inevitably, oh my God, if that's the responsibility, then what is my commitment to meeting that responsibility? And I'm thinking, of course, money, of course, investment, maybe insurance, I don't know. But very quickly, Dr. Lito also reassures me that, yeah, but don't look at it as expense, look at it as investment. And that really, struck a chord in me. Oh, nga, no? One of the things that we proactively invested in during the pandemic was healthcare, mental health. And we have a young mental health group that's a startup as well. Collab kami. And what they do is they walk us through their workshops online for mental health and building a culture for wellness within the company. And we look at that as an investment and not as a cost. When you look at it that way, and I'll end with here, I completely agree with Dr. Lito that if you look at our journey as a startup, what ties us with you is not just the same concerns that we have for our health, but what ties us with you is actually the opportunities that we grabbed of the opportunities provided by groups and experts offering their expertise in healthcare. We need to build into our companies and into our work environment a mindset for health as right and as investment. But we need help in policy. We need help in training. We need help in culture. We need help in leadership because we don't have that. We appreciate it, but we don't have that. And maybe that's an opportunity for everybody here. Dr. Lito speaks for one of the biggest, groups, conglomerates in the Philippines. But the reality, and he knows this, and everybody knows this, the lifeblood of our economy is micro. The lifeblood of our nation is micro, small, medium enterprises, and this is where we are as micro, where I think we can relate with a lot of groups that are saying we appreciate all of this, pero liit namin. Wala naman kaming kakayanan. Di naman kami, First Philippines Holdings. Di naman kami kung anong ang group dyan. We're not a major corporation. And I think healthcare workers and your expertise and your sector can help to develop tools, products, and services built for small groups like ours who can appreciate that, maybe I start looking at this from the perspective of rights. Maybe I start looking at it from the perspective of investment and not as expense, not just as a responsibility, diba? Not just as kahiyaan na to, or not just as a matter of compliance. But for us to do that, more people need to have access, as I have access to you right now. And I can only imagine what if this comes not just a movement, but real services that small companies and enterprises can take on, whether it's individual consultancies to be offered or template handbooks that you can hand out, or genuine training programs, as well as advice that you can offer companies on how to structure themselves, however small, how to create policies, how to get the best practices that you have, and how to build healthcare and in a post-COVID world into the small enterprises that we have, so that we not only can afford it, but afford it very, very happily, acknowledging that it is a matter of rights, responsibility, and also ultimately investment. So yan. Maraming salamat po.
Oh, thank you so much, Robby. Nako, another thought-provoking, papakan nga natin yan. Another thought-provoking talk, ha? It's, I'm so happy you came, Robby, because I didn't know what to expect, but I think you were able to connect so many of the dots. And I think when we go into the discussion, I actually have some thoughts about what you were asking. How do the small and medium enterprises survive it, right? Because the bigger companies, of course, no. Pero on the other hand, media like health, we never stop, right? It's like it's a what should I say? It's a fundamental service. It's a basic service that cannot afford to be locked down, no. So anyway, okay, I will reserve some of my comments. Raymond, did you want to say something before we go into our quick break?
No, I just wanted to say thank you to Robbie for really expounding some more and emphasizing the need for better communication, no? Especially with all of the announcements and how practically we should be moving ahead po. But before we we start off with our questions, we'd like to ask Dr. Lito GAPAS to open up his camera. And then in the meantime, we'll have a quick break for our special public service announcement today.
Maaari na bang magpabakuna ang mga batang 5 hanggang 11 taong gulang?
Oo, nagsimula ito noong Pebrero.
Nagpapakuna na ba kayo?
Oo, nagpapakuna na kami.
Ang mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children age 5 and up. We hope you'll share this video clip to all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. So, Dr. Susie, we have a new format for today, no? Just like last week, maybe we could have our questions. And tawag po kasi dito sa ating segment, Ask the Expert. Pakinggan ang mga tanong ng taong bayan. Let's have the first video.
Ang unang tanong ko po ay, ano pa po kaya ang mga pangangailangan ng mga healthcare workers ngayong pandemya?
Noong June 2020, sa mga kasama ko sa kolehiyo na matapang na pumasok sa opisina at gumampan ng kanya-kanyang trabaho, sabik tayo na makarinig na pangungumusta. Pero 2022 na, hindi pa rin natin naririnig yon. Ako na lang kakumusta sa inyo ha. Kayang-kaya naman natin, di ba? Sa palagay niyo po, paano po madadagdagan ang hazard pay at panahon na rin po ba para i-review ang panuntunan sa pagbigay nito na nakapaloob na rin ang mental health wellness ng healthcare workers?
What are the guidelines or what kind of some protection for healthcare workers do you give for those working abroad healthcare workers?
Okay, so as we've done before, no, and I'm just concerned, Raymond, that we won't have the time to do all the questions. We have 3 more great questions, but
No
what
problem.
we're going to do is we'll take the 3 questions as a takeoff point for discussion, but we're going to ask Lito to respond to the 3. So Lito, take it away.
Thank you very much, Susie. Una kong tumbukin yung hazard pay. Okay, kasi I'm very sensitive to it because if you look at it from a distance and analyze it, we do not want to trade the health and safety of workers for money. Kasi babayaran mo sila para sa hazard. So where I'm coming from is, organizations, companies big and small, is morally responsible to put in control measures in their operations to make sure that the risk to health and safety of their workers are reduced to as low as reasonably practicable.
So
Yun
it's the
muna,
prevention. It's the prevention, Lito.
yeah. Oh, we should invest in prevention. We should prevent in control measures. But we should also invest in consequence management. Kung halimbawa may magkasakit, ano yung gagawin natin? May suporta ba tayo? Yun ang unang-unang importanteng pag-usapan. We need to reduce the risk of the hazards in our workplace before we technically accept that we can no longer do something to reduce the hazard. And instead, pay the workers to do something. It is not, it applies to many workplaces. Pero meron tayong mga trabaho na talagang kailangan kami hazard pay. Hindi mawawala yun. For example, ikaw ay sundalo. Wala kang magagawa kung yung kalaban mo, babarilin ka talaga at susugal ka ng buhay. But you can reduce that. Pero you can only reduce it so much. Pag ikaw ay healthcare worker na nasa frontline ka, control measures can be only reduced to as low as reasonably practicable. After that, you might begin to think about hazard pay. Pag ikaw ay police, so these are special jobs na after all the effort to reduce the hazards in the workplace, merong remaining hazards, then it should be made realistic and real. And the company and the worker is fully aware of this and embrace it before moving to hazard pay. So yung tanong na gaano ba talaga kataas ang hazard pay? Ang hazard pay is always proportional dun sa risk na tinatanggap natin na kasama sa trabaho.
Yeah,
And
Lito.
also,
Yeah, Lito. I'm thinking, no, and going back to Robbie's question, di ba? About kasi I think you're talking about it from the private sector perspective, right? I'm thinking, government has a very big role to play in the, sabi mo kasi probability and consequences, di ba? Dun sa consequences part, di ba? For example, no, and I think I like Robbie to react to this. My sense, if you ask me, is that testing should be either free or heavily subsidized. And that will help all workplaces across the board. Kasi hindi kaya ng hindi kaya ng maliliit na kumpanya, hindi kaya ng maliliit na even hospitals, no? I remember when I was in the Red Cross, 6 na buwan na, hindi pa natetest yung mga health workers natin. So I think there is a role for government to step in and mitigate the consequences that cannot be afforded by workplaces. But I don't know, so I'm going to ask Robbie to respond to that.
Yeah, that would be great, di ba? Parang we're also managing our expectations here because we've been in 2.5 years of the pandemic. It's one of the questions that we keep asking as media and as a people, di ba? Especially as you get exposed, as we said, to other countries. I've been in other countries na talagang yun talaga, it's free.
It's
not
free.
just for citizens, even for tourists.
Visitors, for tourists. In fact, no. I don't know. I can't remember what it was. No, I was looking at the data on the cost of a test kit. I think in Turkey, compared to the cost of a test kit, an antigen test kit in the Philippines, it's about 10% of the actual cost in the Philippines. No, so parang there's something funny with the way we're doing this kasi inaasa natin doon sa pribadong sektor. I don't know, Lito, ikaw naman, anong tingin mo doon?
Tama ka dun, Susie. No? I fully agree that there are very basic and fundamental control measures. For example, COVID. And this very basic and fundamental, I think government has a big responsibility for this. Because to be honest, the DNA of private sector is profit. That's the essence of being of a private sector. Whether big or small, kailangan kumita, which we need to bypass. So if there are affordable services and tools we can extend to our population, government has a very big role to play in this.
Oo, kasi protective yan of the workforce eh. You know, we have been talking about completely subsidized or free testing for a long time on this webinar, but nada, right? We don't have money. Of course, we have money. No, parang if we're looking at it as investment, that's your investment. That's how you protect. That's how you're able to, as you were saying, Robbie, no, meron kang staff na nagkasakit, di ba? So question is, makakabalik na ba kami sa bahay? Syempre, ite-test mo, di ba? Eh kung gagastusan mo lahat yun, tapos paulit-ulit everyday ka nagte-test, eh hindi talaga kaya yun ng ano. And you know, for me, okay, go ahead, Robin. Oh.
Not only that, I won't get into, you know, what's wrong or but just an insight on human behavior. When you go to places where testing is free, kahit gaano ka-hassle yun, people actually take it. Even for tourists, even if tourists, for example, I was in Vienna, and it was free. You could not walk, I don't know, maybe you could not walk 500 meters without seeing a testing site. No? And it came with this was around September last year. So whatever that situation was, but apart from it being, it wasn't really a requirement. It was if anything, the incentive was if you take an RT-PCR, you're good for 48 hours. You can go to the bars, you can go to for 48 hours. Kung antigen lang yung kunin mo, you're good for the night, di ba? Yung mga ganyan.
Right.
But ang isang insight ko is people will walk 500 meters every day. Doesn't really matter. So the distance wasn't an issue. Maybe even the incentives, of course, help. But ang insight ko doon was people will do it. So the only barrier is really the cost.
And it's the access. It's really the access. Kasi ano rin yan no? In other places, okay, I will not talk about the United States because it's a different situation, but this thing about masking, that it's voluntary indoors. What companies have done all over the world is when you enter the department store, you get a free mask. You know, so it's like your behavior, our behavior is to a large extent determined by our environment. And so I think we sort of got fixated on, you know, bahala na yung mga tao to do it. I really don't agree with that. Anyway, okay, let's go to the second question because we will not, Raymond, we're not going to go into the second round, right? We're going to ask Lito to answer the two other questions that were asked, and we'll have to wrap. Yeah, okay, go ahead, Lito.
Pagsasamahin ko yung dalawang questions kasi yung unang question is how can we better protect our healthcare worker? I think that's the first question. Can we add more? Yung second question is what are the guidelines for healthcare workers working abroad? Okay. Basically, the message is based on what we know right now. What are the control measures that we have available for healthcare workers, both to prevent infection and to control the consequence? Walang kaibahan kung ikaw ay nagtatrabaho abroad or locally. Alam natin yan. Meron tayong resources. Ang problema lang sa Pilipinas is, number one, we've talked about cost and access. We need to improve on that. Number two, we need to have, actually papasok na yan sa implementation, consistent implementation of our healthcare strategy. Magaling ang Pinoy mag-isip, maraming organizations, maraming hospital. Magaling mag-isip, magaling magsulat ng mga protocols at programa. Magandang implementation at the start. But as it moves forward, it wanes. We're no longer consistent. And hindi lang naman yun sa mga nag-implement. The compliance of health workers and many workers even outside of health, big or small business, also wanes. So I think we should work on that more. Nandun tayo sa consistency of implementation, nandun tayo sa consistency of compliance, at saka yung mga nilalagay nating control measure should always be risk-based and science-based. So in short, wala naman talagang pagkakaiba. Alam naman natin ang dapat gawin eh. Meron lang mga few resources na limited tayo, like vaccines, like therapeutics, pero pwede natin gawin yan. But protecting the health workers, we read the same books, we went through the same experience, and we hope we learn the same things going through the experience. Thank you.
Yeah, so maganda, no? Dito parang may call to action ka talaga na what can we actually do? Okay, we are out of time. I'm really so sorry about this, but we're out of time. So we're gonna go, Raymond, to your fun quiz answers, and we won't be able to take any more questions from the audience.
Thank
Pero
you.
napakaganda ng ating
Very good. Very good, Dr.
pinag-usapan.
Susie. Okay,
Yeah, go ahead.
yes, there we go. For our first question po, no, ano ang ibig sabihin ng healthy and safe workplace? Dr. Lito?
Yes, doon sa tatlong options, access of workers to services, that's true. There is good conversation on health and wellness in the company, that's also correct. And the company should have policies to make sure that what are the benefits and programs are clear and sustainable for the long term. So ang sagot dito natin, all of the above.
Ayun, very good. For our second question, these are examples of opportunities for healthcare workers. Dr. Lito?
Okay, I'll start for the second one. Healthcare workers are one of the most important resources in the country. Of course, we are the backbone in terms of the health needs of the country. Health workers were given a voice in the policy and decision making. We have the opportunity right now. It's a question of are we going to take advantage of it. Health workers have become competent in communicating health and using IT technologies. Of course, this is what we're doing right now. The webinar is a good evidence of that. And health workers realize the importance of life-work balance. That's true. So all of the above, Raymond.
Okay, thank you very much, Lito. We're gonna give Lito and Robbie a minute or so to formulate their parting words for our webinar, but and for the audience, I mean. So, but Raymond, we're gonna go into the evaluation.
Paul,
So
Dr.
we invite
Susie.
all of you
Yes,
to
yes.
participate in the
So,
evaluation.
we'll take this time to have them take a brief rest and then formulate their messages to our audience po, no? It's a 5-questionnaire survey, 4-point Likert scale po, and we hope everyone will be able to participate and answer po. First question, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this evaluation poll po, no, until the end of the webinar as we move on to the final messages of our speakers. Dr. Susie?
Okay, let's go to Robbie. Robbie, parting words for the audience.
Yes, for me, it's just thank you. And beyond that, gusto ko lang magbigay pugay sa healthcare workers natin. Like I said, when I was invited here, it seemed, I felt not necessarily out of place, but certainly daunted because this is a conversation that is primarily, of course, very important to the healthcare workers and the public health sector that have already given so much heroically at heroic levels for our country and for the world. So, una-una, I want to acknowledge that and certainly express that I'm in no way equating what we've done and what we've tried to do these past 2 years to everything that you went through. So maraming salamat and saludo po sa inyong lahat. And then let me just say thank you because I think listening to Doc Lito and to the conversation we're having, it gives me a little bit, not just a little bit, but much more confidence coming from a very, very fundamental perspective. As I said, that it's not just about rights and responsibilities, although that itself already elevates the perspective and the framework of how to look at this, but the pragmatic way of looking at it as an investment. It's less romantic, but it really is very, very fundamental and very important. It's a mechanism in the thinking that allows it to turn on, to attack it with more excitement rather than the pure dilemma that we had. So maraming salamat po.
Thank you so much. It's Robbie Alampay, Chairperson and CEO of PumaPodcast.
Not CEO,
Okay,
chair lang, hindi ako yung CEO.
Chair. Ay, hindi ka CEO. Sige, Chair. Sige, Lito, your turn.
Yeah, to all health workers and workers in general, for the past 3 years, parang napakabilis. And here we are right now. We are thriving. But please note that there has been a tectonic shift in how many stakeholders look at health at present. Marami silang natutunan. Marami rin tayong natutunan, and I hope we are more aware of the favorable and positive changes that is happening and will continue to happen to health and the health sector and the health workers in particular. Please be conscious of these changes and use it to full advantage. Meron pong silver lining sa ating health workers. And I think our future is brighter after the COVID outbreak. Let us make sure and prepare ourselves when we are ready to take advantage of this. Thank you.
Thank you very much, Dr. Lito Gapas of First Philippine Holdings and Adjunct Faculty with UP College of Public Health. So we're going to our closing remarks, and I'd like to call, oh no, not yet. Are we closing? Yeah, we are, Raymond, no? So
That's
I'd like
correct,
to call on Dr. Stella Jose, our Deputy Director for the Philippine General Hospital. Stella, go ahead.
Good afternoon, everyone. We had another interesting webinar today from Dr. Lito Gapas and Mr. Robbie Alampay. First of all, at the start of his lecture, Dr. Gapas expounded on the risk to our workers, our health, including our healthcare workers. He noted that it is considerably lower. He made this formula, the risk equal to the probability multiplied by the consequence. So that's really interesting. And he said, what is the probability? It is the chance of getting infected. Okay, so what lowers your chance of getting infected is vaccination and the established minimum public health standards, the return to work screening. So workers are screened before they go to work, testing, the good ventilation in your workplace, and hybrid work, more virtual rather than in person, and the education and awareness of the healthcare worker. Now, what about the consequence? It is the severity of the outcome. Okay, so for example, he said that vaccination is the key to this in this situation, the early diagnosis and treatment, the focus of high risk groups. So we know that high risk groups are more likely to have morbidities and mortalities, and so our workers who are high risk should learn and follow the minimum healthcare standards. The medical facilities are better prepared, and the Omicron subvariant had lower disease severity. However, we should not let our guard down, according to him. So now the virus is endemic in our native population, and there's some sort of development of the herd immunity. And however, if we lose track of this can disappear, this immunity, and again there will be the gradual loss of immunity, resulting to the re-emergence of a viral infection again, of a COVID virus infection again. Okay, so what are the driving forces to this? So he mentioned the immune escape, the waning immunity, and the uneven vaccine distribution. No, that's mentioned in all our other webinars. Vaccine hesitancy is still high in our country. The lack of political will and integrated and conditioned global effort reservoir. Okay, so another what he mentioned is also the prevention for future outbreaks. So parang he's looking at it from in the future. No, so he mentioned that we have to protect human and animal health and their shared environment via global strategies. So it should not be limited to our country only. So remember that this virus started in China, in Wuhan, okay, and it was an animal reservoir. And he mentioned linked issues of vaccination of human and animal reservoir, animal and humans monitoring to promptly identify a potential epidemic emerging. And lastly, which I really agree totally, is the prevention and management of health risks, depending on protecting and preserving the environment. So really, all of these are intertwined so that we will have a healthy healthcare worker. Mr. Roby Alampay, in the discussion, also mentioned that government must step in when the private sector could not afford testing, and the employee must be given access to testing and treatment. And he mentioned that in his trip abroad, that people would line up just to be tested. And he thanked the healthcare workers, for what they have done and the sacrifices that they did for our country. Oh, back to you, Susie.
Okay, thank you so much. That's Stella Jose, who is the Deputy Director of the Philippine General Hospital. Okay, so next week, magandang topic. Actually, it's been mentioned several times today. It's mental health and wellness. And so we're going to talk about the wellness part. No, how do we all continue to stay well, in this, it's not really post-pandemic, but as we continue in the pandemic. So join us next week. Maganda po yung topic natin. Raymond, over to you.
Thank you so much, Dr. Susie, and thank you to Dr. Stella Jose for that synthesis and closing remarks. So based on what we're seeing in the evaluation poll po, no, at least 91% of those who participated indicated that they strongly agree in all of the questions. So that's a testament to really all of the learnings and insights relayed to us by Dr. Lito GAPAS and ROBY ALAMPAY po for this webinar. So we take note of one of the messages here on certificates po, no? But before we conclude our program, we would like to let you know that all Stop COVID deaths are archived for viewing at the TVUP YouTube channel for your convenience. Also, yung po ating SED shorts, which are very, very short and consumable videos po, they can also be found in the same YouTube channel in TVUP po. So, ano po yun www.youtube.com/TVUPPH for you to be able to see all of our webinars po, no, 125 ngayon, and then after today, it will be 126 po. So maraming salamat po sa inyong lahat. Sana po makita po tayo again next week po for our exciting new topic. And this formally closes our webinar for this week. We look forward to your company again on our next Friday. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.